What's up, y'all? It is Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology to women and adolescents, where we use a holistic and traditional form of medicine, as well as offering weight management, hormone pellet therapy, intimacy services, total wellness with supplements, and laser hair removal to both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. So I'm super excited to be here today on February 1st. It is definitely Heart Month. That's why I have on my red. So Heart Month, and we really like to focus in on women because we present with heart disease so differently compared to men. So let's just go through a few things about heart health. As you know, heart disease is the number one cause of death in the United States of America for men and women. And let's talk about some symptoms or signs associated with increasing your risk of heart disease. So first, having high cholesterol, especially if it's not controlled, increases your risk of heart disease, but that is considered what we call a controllable factor. So by controlling your cholesterol through diet, exercise, and then and changing your diet, decreasing the saturated fats in your diet, making sure you're decreasing the fried foods in your diet, eating less pork and beef and more of the chicken and turkey and seafood will definitely help with your cholesterol. However, some people are just genetically predisposed to high cholesterol, and no matter what they do, they still have high cholesterol. And in those instances, there are things that you can do, including medications, to better control your cholesterol to decrease your risk of heart disease. Also, high blood pressure, especially uncontrolled high blood pressure. So your blood pressure should be anywhere from 125 over 85. Your blood pressure should be 125 over 85 or less to be considered normal blood pressure. It's slightly elevated when it's the 135 over 95. And after that, you definitely need medication. Sometimes we will allow you to try to change your lifestyle, decrease the salt in your diet, increase your exercise, lose weight, and then change your diet to help control your blood pressure. If we can't control your blood pressure with lifestyle changes, then it is necessary for you to take medications because uncontrolled high blood pressure increases your risk for heart disease as well as stroke. Also, physical inactivity increases your risk of heart disease. When you don't move, when you don't exercise on a regular basis, when you're always sitting, that increases your risk of heart disease. Of course, being obese or overweight. And when we're talking about weight, we always look at BMI, body mass index. If your body mass index is over 25, you're considered overweight, up to 29.99. Once it's 30 and over, that's considered obese. Once it's 40 and over, that's considered morbidly obese. And we are seeing people who have BMIs all the way up to 70, 80, and 90 in 2025. And unfortunately, it's becoming a normal thing to see, which is why we'll talk a little bit about weight management and some things that you can do to better control your weight to decrease your risk of heart disease. Because remember, it is Heart Month. We are focused on decreasing your risk of heart disease. And today I'm going to talk a lot to women about the risk of heart disease and some things that we can all do to decrease our risk. So if you're just coming in the room and listening, we are talking about heart disease being the number one cause of death. It is Heart Month in February. So we're going to focus on that. And we definitely want to talk to men and women about decreasing their risk. And we also want to make sure that women understand that heart disease can present very differently for us. Sometimes we don't have typical left chest pain or the shoulder pain, radiating to the shoulder. We may not have the shortness of breath. We may not have the pain. It may be something more like nausea and fatigue or just not feeling well. But if you're going to the doctor regularly, checking your blood pressure on a regular basis, especially if you have high blood pressure, monitoring it, because what we do know is medications may work for a while and then your blood pressure can go back up. But the only way you know your blood pressure is not being controlled is if you're checking it on a regular basis. So seeing your doctor on a regular basis, if you don't have high blood pressure, no real risk factors, you're fine, but you can still check in between doctor visits, especially if you're young and not going very frequently. If you know you have high blood pressure, you're taking medication for it, or you're making lifestyle changes to control it, you should be at home taking your blood pressure on a regular basis, keeping a diary. So when you do go to the doctor, if it's elevated, you can show them that at home your blood pressure stays under control, or you can show them that sometimes it's high and sometimes it's not. One thing we'll also talk about is CPAP and sleep apnea and how that can negatively affect your blood pressure. And sometimes that may be a sign, uncontrolled high blood pressure, or blood pressure being normal 1 minute, abnormal the next minute. Those are signs of, do you have sleep apnea? And if you have sleep apnea, you tend to snore, stop breathing during your sleep. Most people don't want to sleep in the same room with you because of the snoring, because of the sleep apnea. So if those things are happening, it's definitely worth you getting a sleep study so that you can rule out sleep apnea, because untreated sleep apnea can cause high blood pressure, and untreated high blood pressure can cause heart disease, cardiac events, strokes, and death. So we're also talking about how we can prevent heart disease during Heart Month. Smoking also is a risk factor that's very controllable. So don't smoke. If you have type 2 diabetes, control your type 2 diabetes. Keep your hemoglobin A1C at a normal level. And that can be done with lifestyle change, weight management, as well as exercise, changing your diet. So basically, to control your heart, or protect your heart, eating a healthy diet with lean, healthy protein, making sure you're getting your healthier, more complex carbs in, decreasing your sugar and salt in your diet, making sure you're still eating your healthy fat, exercising, eating the frequent small meals, having breakfast in the morning. Those are all some things that you can do to help control your weight as well as diabetes. And then high blood pressure, making sure you are actually taking the medication. Make sure you're monitoring your blood pressure. Make sure you're journaling your blood pressure. And for everybody, making sure you're seeing your doctor, getting your screenings, making sure your cholesterol is not elevated, making sure your blood pressure is not elevated, making sure you don't have diabetes. So not forgetting about the screenings for your primary care doctor. I know a lot of women in their 20s to 50s, we all think about the gynecologist, going to the gynecologist. I want y'all to see me every year. However, I also want you to have your regular screenings with your primary care doctor every year so that we can recognize if you have risk factors, especially controllable risk factors. We can actually fix those risk factors by treating the disease, like high cholesterol, high blood pressure, physical inactivity, obesity and being overweight, type 2 diabetes, and smoking. Those are all controllable risk factors that we can change and improve to decrease our risk of heart disease, strokes, and death. Uncontrollable risk factors include increasing age. You cannot control increasing age. We want to all age well because that means we're still living. So that is an uncontrollable risk factor for heart disease. So the older you get, the more at risk you are for heart disease. Having a family history of heart disease, especially early heart disease, heart attack before 50, that is a hereditary risk factor that's uncontrollable. But if you know that, then you know you should be getting your screenings and making these lifestyle changes we'll be talking about all day today. Race, African Americans are at higher risk for heart disease and at higher risk for uncontrolled factors that attribute to heart disease, like not controlling our blood pressure or going to doctors who don't care about controlling our blood pressures. Unfortunately, I see a lot of my African American patients or Black patients, whatever you prefer, coming in with high blood pressure, but they're actually seeing a doctor, and the doctor is not telling them to that it's not okay for them to have high blood pressures over 125 over 85. If you are taking medication, you have known high blood pressure, and your blood pressures are still running over 125 over 85, you need to let your doctor know. And if that doctor cannot control your blood pressure, go to a doctor who can, because unfortunately, what I see as a Black physician, seeing several patients of different ethnicities. I have white patients, Black patients, Asian patients, Indian patients, Mexican patients, rich patients, poor patients, all kinds of patients, normal weight patients, overweight patients. The patients who I see coming in with uncontrolled high blood pressure that are actually seeing a doctor are my Black patients. So we need to make sure that we are finding doctors who care about us, who take good care of us, control our blood pressure, send us to specialists if they don't know how to do it, because we do have a history of having uncontrollable high blood pressure. And that is because when we were brought over on the slave ship, the only people who could actually survive on the slave ship were the people who were selected out for being salt retentive, because because you were not eating or drinking. So you had to have a lot of the people who survived the slave trade had high blood pressure anyway, and that is how they were able to survive, because their blood pressure didn't fall so low because of the lack of food and water on that long trip on the slave trip coming from Africa to the United States of America. So that is why we see so many Black people with this really significantly uncontrolled high blood pressure. We are genetically predisposed to it, but it doesn't mean we can't find doctors who can control it and see specialists, like a cardiologist. If you're going to primary care doctors and they cannot keep your blood pressure under control, it is time to see a specialist, like a wonderful cardiologist, like my favorite cardiologist, Annabella Simon Lee, over at Alabama Cardiology at Brookwood Hospital, along with her husband, Dr. Tim Lee, who is an interventional cardiologist. I can send any of my patients to them, whether they have a low socioeconomic status, no matter their race, no matter their gender preference, and they're going to get the best care. And I know that they're going to get their blood pressure controlled. So find doctors who care enough about you to control your blood pressure to decrease your risk of death from heart disease and stroke. And then control the controllables. If you don't smoke, maintain a healthy weight, decrease the salt in your diet. If you have diabetes, control your blood sugars by changing your diet and making sure you're on the right medications. If you have high blood pressure, making sure you're maintaining a healthy blood pressure of 125/85 or less. And then making sure that you are decreasing the salt and the sugar in your diet for your health. So those are some things that we can definitely do to help control blood pressure. So to decrease your risk, a healthy diet, low in saturated fat, no trans fat. You avoid trans fat at all costs if you can. And then making sure that you are eating a diet low in sodium as well as cholesterol. Keep your weight under control. Remember, a normal weight is a BMI of less than 25. However, everybody may not be able to get to that point, but at least do the best that you can to eat a healthy diet, have breakfast in the first hour of waking up, eating your frequent small meals, and making sure you're monitoring your calories, decreasing the pork and beef in your diet, increasing the fruits and the vegetables and the healthy fat and the lean protein, like your seafood, your chicken and your turkey in your diet. Lamb, that's a good meat to have in your diet, as well as bison. Be physically active for at least 30 minutes on most days of the week. So that's what I do. I do 30 minutes, 4 days a week. So I am at minimum doing what the recommendation is. However, I should be doing a little bit more cardio. So I should be doing at least 30 minutes of cardio 2 to 3 times a week on top of my 30-minute resistance training and kind of boot camp exercise. So figure out a way to get some physical activity in so that you can decrease your risk of heart disease. Controlling your blood pressure and cholesterol levels. And like I said, some people are predisposed for high blood pressure, but find a doctor or a specialist who can control your blood pressure. If your primary care doctor is saying your blood pressure is just too difficult to control and they're okay with you coming in with the elevated, find another doctor, find a good doctor who cares about you and who's going to take good care of you, because all blood pressure can be controlled. And I have a wonderful cardiologist that I refer my patients to when their primary care doctors can't control their blood pressure. Monitoring your cholesterol levels, making sure you're keeping them under good control, making sure that HDL is good. The good cholesterol is over 45 or 50. Improves your heart health. And then manage your blood sugar if you have diabetes. If you know you have diabetes, don't drink sodas, don't eat a lot of sugar, decrease the simple carbs like the white bread, the white pasta, the rice, the white rice, and the white potatoes. Instead, use brown rice, wheat bread, wheat pasta, and sweet potatoes. Those are some things that would definitely help with your blood sugar and your glycemic index. Get regular medical checkups. See your primary doctor at least once a year. See your gynecologist if you're a woman at least once a year. If you're a man, see your primary care doctor once a year. If you have some other medical problems, make sure you're seeing your specialist to help control those. For men, a lot of time that would be a urologist that they may be seeing because of some prostate issues or some changes in their PSA. But make sure you're seeing the doctors that you need to see. If you have uncontrolled high blood pressure, or if you have high blood pressure and diabetes, you still should be seeing a cardiologist on a regular basis because we know you're at increased risk. So make sure that when you're getting all these screenings, like your pap smears and your mammograms and your prostate exams for men and women, make sure you're also getting your your testing to make sure you don't have diabetes or high blood pressure. And if you do have diabetes or high blood pressure, having that cardiac workup on a regular basis with the EKG and an echo, and making sure that your vessels are good with the stress test. So those are the things that you should be doing if you have known high blood pressure, heart disease, or diabetes. And then once you get a certain age as a woman, once you're menopausal, perimenopausal, or postmenopausal, you are at increased risk of heart disease. So making sure you're getting those screenings on a regular basis, and make sure you get that first screening around 50. And if you have a family history of heart disease, making sure you do it around the time the people in your family actually get heart disease. All those things are going to be very, very important. So this is Go Red Month. So the goal for February is to give to understand heart disease, to understand your risk for heart disease, to make sure that you had the proper screenings, and making sure that you are taking the medications, changing your lifestyle, using your CPAP machine if you have sleep apnea, all of the things to make sure you decrease your risk of heart disease. So some things we can do to decrease the risk of heart disease is exercise more frequently, lose the weight if you're overweight or obese. Have that cholesterol checked on a regular basis. Control your cholesterol levels and try to keep them in a normal range. Modify your diet to include healthier foods and take some of the unhealthy foods out of your diet. And then Go Red for Women is a real thing. I think it's something that you all should follow. Go on Facebook, follow them. They have great information about how to prevent heart disease, and understanding that for women, heart disease can definitely present differently, which is why it's so important for us to get the proper screenings so that we can decrease our risk of heart disease. And then remembering our controllable risk factors, controlling those. The uncontrollable ones, we're going to continue to do our prevention and screening and live the healthiest lifestyle we can to decrease our risk of heart disease, which is the number one cause of death. So let's go over some things that you can do for a healthy lifestyle. First of all, water. Drink half your weight in ounces of water every day. So if you weigh 200 pounds, drink 100 ounces of water. You can break that up over your 5 small meals. Eating frequent small meals instead of eating 2 large meals a day or 1 large meal a day. Eat the frequent small meals. Have breakfast in the first hour, and eat within the first hour of waking up. That's breakfast. If you eat it after an hour after waking up, that's not breakfast anymore. You're eating your snack. So within the first hour of waking up, make sure you eat something. If you work out first thing in the morning, like I do, eat something within the first hour of finishing your workout. Eat a lean, protein, high fiber, low carbohydrate diet. You also can have healthy fat. Healthy fat is important. So olive oil is doing more unsaturated fat than saturated fat, and avoiding trans fat at all costs. Exercising at least 150 minutes per week, and drinking water when you feel like you're hungry sooner than you should be, making sure you're hydrating, because sometimes dehydration can make you feel like you're hungry. At Me Bella Wellness Center, we have an amazing weight management program where many of our patients are losing lots and lots and lots of weight. And it's because they're changing their lifestyle. We do use health aids. We do use the GLP-1s. We do use some of the amphetamines that help with weight management and help control appetite. We do use Contrave. We use all of the medications that are out there. However, we use them differently from most people. First of all, we have you to come in, do that resting metabolic rate test where you breathe in the machine. It tells me exactly how many calories you need to eat to maintain weight and to lose weight. I write you out an eating plan. Depending on how many calories you get, you may need help with your appetite, and you may need help with your cravings. So we decide which medication is going to work best for you. And then it may be one medication, it may be multiple medications. And we also have some great supplements that work really well for weight management, including on our mebellawellness.com/shop page. You can find the CLA and alpha lipoic acid, which both help with your insulin and blood sugar levels, as well as your holding on to muscle mass. We also have the Meta Boost, which has the Garcinia cambogia to help with appetite, the African mango, the green tea. All of those things are going to help with your appetite as well as your metabolism. And then we also have a mood and appetite, which has 5-HT in it, which helps a lot with making sure that you don't have all that emotional eating. So you can take it any time of day. I have my patients to start taking it at around 2 or 3 because that's around the time that people start having the cravings for the afternoon, especially if they haven't eaten correctly, eating the protein, getting the 70 to 90 grams of protein in a day, depending on your weight. More if you're at higher weight, less if you're at lower weight. Making sure you're doing the frequent small meals, making sure you're eating plenty of fruits and vegetables, as much whole food as possible, decreasing the processed food in your diet because we don't know what God awful things they're putting in the food that's processed. Making sure if you're going to eat fat, you eat the you do olive oil and regular butter. Avoid margarine. It has trans fats in it. Do not use anything that has trans fats in it because it means it was processed and it's not a healthy fat for you to consume, and it's definitely not healthy for your heart. Exercising regularly, monitoring the salt and sugar that you have in your food, and then maintaining a healthy weight. And now that does get older as we age and mature. So if you're in perimenopause like me, meaning you're over 35 or 40, you're starting to have symptoms of night sweats or problems with sleep, decreased desire, decreased enjoyment of physical intimacy, fatigue, joint pain, belly fat, mood changes, mind fog. That's for men or women. Men and women, that means that your testosterone levels can be low. Get your testosterone levels checked because testosterone, the forgotten female hormone, is actually important for healthy weight management. Testosterone balance helps to improve your maintenance of muscle. You need muscle for your metabolism. You need muscle to protect your bones. When you exercise and you're in perimenopause and your testosterone levels are low, it's hard for you to maintain muscle, which makes it harder to lose weight and to maintain a healthy weight. So testosterone balance plays a huge role in healthy living as well as healthy weight management. Testosterone replacement also decreases your emotional eating. So you're less likely to crave the salts and the sugars in the afternoon, which helps to better control your weight. And then you have energy when you have when you're hormonally balanced with testosterone. That is going to help you have the energy to exercise so that you can build the muscle to help with your metabolism and to protect your bones. So hormone balance plays a huge role in weight management. A lot of my patients that come in with the symptoms of perimenopause notice that once we balance their hormones, it's much easier to lose the weight. And they notice that with provider or physician, nurse practitioner directed weight management by trained professionals, they tend to lose more weight and they're able to keep it off. So we are trying to prevent heart disease. We're educating about heart disease, the risk factors, the things, the easy things that you can do to control the controllables, controlling your blood pressure, controlling your blood sugars, controlling your cholesterol, seeing your doctors, doing your preventive services as well as your screenings, and not leaving out the heart screenings with that. When you go into menopause as a woman, you should definitely have a cardiac workup by then. If you have a strong family history of heart disease, or you have known high blood pressure, diabetes, or heart disease, obviously you should be monitoring your cardiac health, because the number one cause of death in the United States of America for both men and women would be heart disease. One of the most preventable risk factors or causes of death would be obesity. So maintaining a healthy weight plays a huge role in protecting your heart and staying healthier longer. That's going to be huge. And then not smoking. That's something that you can control. Avoid smoke, secondhand smoke, as well as you smoking yourself, because that increases the risk of heart disease as well. So today we have thoroughly reviewed all the things that you can do for Heart Month and for the rest of the year to decrease your risk of heart disease, stroke, and death, and making sure that you can live your best life, because we want to feel good, we want to live well, we want to age well, because we all want to experience everlasting intimacy, and understanding that intimacy plays a huge role in your heart health. So men and women who experience regular physical intimacy and have regular big O's are going to have a healthier heart than women and men who don't. So women who engage in regular physical intimacy, whether that's with a partner or without, and they get the enjoyment and they reach their peak, they're going to release these great endorphins that improve their health, their wellness, how they feel. They're going to feel better. And women who have regular big O's live about 5 years longer than women who don't. So I always emphasize the importance of living a healthy lifestyle, the total wellness component, the prevention, and doing all the things that we can do to live a healthy lifestyle. So if we live well, we should be able to age well and enjoy and continue to enjoy living as we continue to get older, because we're doing our part to live our best lives through total wellness. And then that way you can always experience the gift from God, which is everlasting intimacy. If you think about it, those people who continue to have everlasting intimacy throughout the different stages of life, those are people who tend to work really hard to stay healthy. They tend to exercise. They tend to eat healthy. They tend to avoid chronic disease or control chronic disease, because sometimes it's just we're genetically predisposed, and no matter what we do, we may have high blood pressure or high cholesterol. But controlling those numbers will decrease your risk of heart disease and allow you to live your best life, to age gracefully, and to experience everlasting intimacy. So if you have any questions, you can put them in the chat or the comments. I'll be happy to answer them. If I don't catch them while I'm on here now, I will go back and catch them. But guess what, y'all? I got some exciting news. We are having our first intimacy event since 2019. It is called, you ready? The Foreplay Ageless Vitality by Dr. Mia, presented by Mia Cowan, MD. It will be on March 15th from 9 o'clock until 3 o'clock at the UAB Hilton. I'm going to have some amazing guests. Some of them you know from the area, like Dr. Cree, who is an amazing family practitioner here in the area. She's actually the doc for Birmingham City, as well as owning Brownstone Family Care and Aesthetics. We also have Dr. Leisha Cox, who is a board-certified psychiatrist in the area. She's going to bring us some amazing information about mental wellness. We're excited to have her. We're going to have Dr. Michelle, who is a mindset specialist, as well as a physician, as well as a holistic specialist and herbal specialist, and she has a wonderful line of teas that I use on every day pretty much for my health and wellness. But she'll be talking about mindset, the things that we need to do to have the right mindset so that we can continue to live well, age well, and experience everlasting intimacy. We're also going to have Dr. RJ from Atlanta, and she's my therapist, and she's going to come in and talk about stress reduction, which helps with heart disease. She's going to be talking about the importance of intimacy, all of the things that we need to hear as women. The focus of this event will be wellness, but we're also going to focus a lot on intimacy, which is not something a lot of people focus on. So we're going to talk about the act of intimacy, how to have great intimacy, and we're going to have some great experts to help us understand what we need to do. We're going to have Coach Peggy Keebler, who is a certified personal trainer, my personal trainer. Actually, she is amazing. She's going to do a demo to show us some good stretching exercises and exercises that we can do while we're perimenopausal and postmenopausal to improve our health and our wellness. And then we're also going to have Dr. Sam, who is a naturopathic doctor. She's going to give us some holistic options for living our best lives and having the best intimacy of our lives. We're going to have Dr. Tracy, who knows everything about everything. She's one of my most amazing smart friends, and she's a burn surgeon and general surgeon, but she focuses a lot on skin and hydroadenitis suppurativa, as well as obviously burn and general surgery. But she'll be there making sure that we understand how to live our best lives through intimacy. She'll be moderating an actual panel, and I'm super excited about that. We're going to have a great time at this event. It's going to be exciting. We're going to learn things and have conversations that we don't normally have for women about intimacy. So we're going to have to focus on wellness, because in order to experience everlasting intimacy, it is necessary for you to live a life of total wellness. And that will be our focus. So look out for our launch on Monday. The tickets will go on sale. We're going to have a discount of $50 for the first, I can't remember if it's 25 to 50 tickets. So as soon as we launch, go ahead and get your tickets. It's going to be an amazing event. You don't want to miss it. I hope you learned something about heart health today. At Me Bella Wellness Center, our goal is to help you live well, age well, and experience everlasting intimacy. And we do that through our great services, but we also do that by educating the community. So please share, share, share. A lot of women and men don't know what they need to do to prevent heart disease, don't understand that heart disease is the number one cause of death. So please share this information with everybody. We should all be informed so we can live our best lives and have everlasting intimacy. It is Dr. Mia. I hope y'all have an amazing weekend. Remember, it is Heart Month. Control the controllables. See your doctors, do your prevention and screening, and go live your best life so that you can experience everlasting intimacy. It's Dr. Mia. We'll see y'all tomorrow. I'll be on with Coach Joseph, and we'll be talking about exercise and intimacy and the importance of exercise, not only for your health, but for you to have and experience everlasting intimacy. So we'll see you tomorrow, same place, 8:30 p.m. Central Standard Time on tomorrow, Sunday. So hope to see you there, and I hope y'all have a phenomenal weekend. Bye.